Good afternoon, everybody. My name is Scott McGann with the Falmouth Health Department. Today's February 24th, 2023, doing our every other week bi-weekly COVID-19 update. Our phone number is 508-495-7485, and our email is health@falmouthma.gov. So, again, these are PCR. If you've seen me in the last year or so, the numbers that are posted are PCR positives, and most people don't use PCR, so these numbers aren't all that accurate. The best way to look at it is if there's a lot of PCR, there's going to be a lot of home tests, and there's going to be a lot of COVID. The lesser, I guess what I'm trying to say is if you follow the trends on PCR, that's kind of telling you what the cases are doing. So 6,250 PCR positives since the beginning of the outbreak, 41 over the 2-week span from the 9th to the 23rd. And that's down from 75 for the 2 weeks prior. So the averaging right around 30 PCR cases per week. Where you would get PCR would be healthcare, nursing facilities, and some people would prefer the accuracy of a PCR, so some people would be doing it on their own. So just look at this as when PCRs are down, COVID's down. When PCRs positives are up, then the cases are up. That's the best way to look at it. Our 14-day daily incidence rate is 11.6, which is down 6.6, and our positivity is 7.72 for the 2 week between the 5th and the 18th, and that's down 3.4%. So all you need to know is COVID's down from what it was in January. Best way I could say it. We are in the low category. We had been in the medium for most of the winter. So that's good. It shows that things have gone down. The 56.34 case rate per 100,000 on the far right was like 90. And the new COVID admissions per 100,000 was like 1213 last time I did this 2 weeks ago. It's 9.6, so all the numbers are on the downward slope, which is good. If you look at hospitalizations from the beginning of the pandemic, you can see the two biggest spikes were both in January. January 21 was Delta. January of 22 was Omicron. And you see how much smaller the bump was this year with the vax and the boost and just the disease sort of it's hunkered down, it's here to stay, but it's not causing sort of these big jumps in hospitalizations. People have had it once, twice, or thrice, and have had 1, 2, 4 boosters or more, and so it's doing its thing. It's mostly Omicron since the Omicron-based one since about the beginning of 22. None of the sort of severity of like a Delta variant would be. So that spike, you can see it's already come down, so that's what our spike looked like. It's a bump as opposed to a spike, so that's good. So yeah, we had more Omicron, let's say early January, the higher numbers, and then it's been tapering off since mid-January, so that's good. Again, we're sort of, high, so everybody's sort of in the 8 to 12 range, somewhere in there for incidence rates. And positivity, we're all sort of clumped in the county in that sort of 6 to 9% with a couple outliers. So that's kind of where we are amongst our peers. The number of cases in this time frame, 3,850. Okay, that was 4,800, I think, when we did this a couple weeks ago. All our trends, this is statewide trends. You see them all sort of flat to low on the downward. And so what's happening in the states is the same as what's happening in the county, and it seems to be the same that's happening in Falmouth. MWRA numbers, these are the two sections of our MWRA, south and the north. You can see that they're all also in the same trend. So everything's coming down from that bump we had in early January, but still nowhere near the far left where you see we're way off the chart coming down for viral particles found. So the higher the viral particles found in the wastewater, the more COVID that's around. So you can see it came way off the chart down, and it's sort of been meandering with, I think we would expect to have a bump in January coming off the holidays and people getting together. So you see that bit of a bump there, and it's come down from there since. So it'll probably, hopefully just sort of meander like it's been doing, like it did from, all of 2022. You see that up and, we have some ups and some downs, and that's kind of where I think we'll be going forward. Again, bivalent boosters are out there. There's plenty to go around. So anybody 5 or over, at least 2 months since their last dose, can do a booster. All your boosters will be bivalent. It means it's got Omicron and original COVID in there. Although when you go get your, if you've never been vaccinated, you go get your first series, that'll be monovalent. We're doing that. Again, vaxfinder.mass.gov is the place to go to find vaccines. There are appointments available. If you have children under 3, you should start at your pediatrician's office. Most of the places will not do young ones. So again, you could call your pediatrician to start, but vaxfinder.mass.gov is where you go to register. As far as getting tests, the convenient MD, the pharmacies, and the hospital are still doing their thing. Most people are using home kits, which are easy to get. We also have had the ability over the last, 9 months or so to get a free supply from the state, and we have been ordering quite a bit. I would say we've ordered between 5,000 and 10,000. We keep them at the senior center. Town hall has them here at the reception desk, the library, the service center. And while they last, I think sometime in May, the state's indicated that they won't be ordering. Our last batch of orders, our last batch that we received on our last order is good till November. So I think, we've ordered what we can, and, we'll keep supplying, the senior center or service center as they need it. You can still get yours easy. You can order them. They're really easy to get, but we do have a free supply, and when they're gone, they're gone. But, we'll order as long as we can, but I think the ordering will be over this spring, and so that's it for that. But home kits are where most people are using, and home kits are great. If you test positive on a home kit, then you're positive. If you test negative and your spouse has COVID, you have symptoms and you're negative, that doesn't necessarily mean you're negative. You should test twice, because sometimes if you have a low viral load in you, it won't pick it up, or it just hasn't had enough time. So, but if you're showing symptoms, test again. That's why there's 2 in a pack, so you could test and then wait a day and test again, especially if you think you probably got it because your spouse has it, or your son or daughter or your best friend or whoever that you've been in close contact is positive, and you're starting to get the sniffles. Just don't say, well, I took one home test and I'm walking away from it, I don't have it. So, you can use multiple home tests while if you're symptomatic and you were in close contact with somebody. But if you're positive, you're definitely positive. It's good on that, in that front. So as far as vaccinations, the state, comes from the state. I just pull it right off their spreadsheet. There was 126 first, second, and booster doses administered between the 7th and the 20th of this month. So we made a little bit of gains. It was 127 for the 2 weeks prior to this report. So pretty consistent, about 125 over 2 weeks, so about 75 a week. So I think everybody who's wanted one has gotten one. I think we just seem to be probably just adding as people get a little long in the tooth from their last one, and that's just sort of trickling in. But I think people have made the decisions on their vaccination status already. What's out there is pretty much all XBB. It's taken over. I'm sure in 3 months there'll be something else that'll wipe out the purple here and be another variant. But right now XBB is what the variant is by and large. If you get COVID, 97% of them look like it's going to be somewhere 94 to 97% probability that it's XBB. So as a recap, we're low, so we did drop. It was a pretty good drop for a 2-week time frame. It's a pretty substantial drop. There's plenty of vaccine and testing capability, plenty of boosters. Like I said, XBB is the dominant strain, and there's no guidance out there that's changed in any way, shape, or form. I don't see anything coming down as well. So that's what we have for a recap. So we had a good couple of weeks, and hopefully the trend continues. And we'll do this again in 2 weeks. Thanks.